All right. Thank you, Dr. Friol, for this kind introduction. I'd like to thank Dr. William for inviting me to speak in this prestigious event, and the scientific committee, of course, and the audience. I'm going to talk today about something that's dear to my heart, which is weight loss and how it relates to cancer. Once you talk about weight loss surgeries or drugs, I mean, what everybody thinks about initially is, oh, I'm going to look better. Then they'll think about, oh, if I have diabetes, maybe it will go, blood pressure will go. Very, very few people realize that this affects their risk, their chance of developing cancer. So today we're going to talk about the relationship between obesity and cancer, and then how we can modify it by bariatric surgery. In short, everybody knows that surgery is an epidemic. It's a problem worldwide, and it's increasing. Initially, when we talked about bariatric surgery, we were talking about how to make people look thinner. Then we started talking about metabolic outcomes. Now we're talking about modifying cancer risk. So, there has been a bit of evidence in the GI literature that linked obesity with pre-malignant lesions, such as polyps and Barrett's. But after that, more data came in that started talking about relationship with real cancer. However, when I went to the literature, I thought this is something new. I found out that there was evidence since the 50s about this relationship. I mean, this was an insurance data from the US. And this was one of the first times that somebody talked about weight loss and cancer. It was this study that looked into how increasing BMI actually increases the risk of mortality. Garfunkel scrutinized this data to understand why the mortality increases. So if you see in the longitudinal diagram, that's that's the normal weight, and then going to the right side, the weight increases. And if you look at cancer incidence, they found out that the cancer incidence actually increases as the weight increased. Later on, a meta-analysis was performed that looked into 28 studies with almost 250,000 people. And they found out that not only does the incidence of cancer increase with increasing BMI, but also mortality from cancer increases. So if somebody with a normal weight gets cancer versus somebody who's overweight, the overweight person has a higher risk of dying than the normal person. So it increases the rate and it increases mortality. This led to the WHO to identify 13 obesity-related cancers. Same thing happened with the American Association. So now, currently, the CDC estimates that 40% of the cancers that are diagnosed in the US were attributed to obesity. And preventing obesity can potentially prevent these cancers. How does obesity cause cancer? So these are the postulated mechanisms. So first of all, we know that adipokines actually increase the mitosis and the cell proliferation of cancer cells. And with obesity, there is an increase in leptin, renin, and visateferin. These are the adipokines that are culprit. Moreover, we know that obesity increases the insulin and IGF, which are implicated in the in delaying the apoptosis. Finally, there is the chronic inflammation with inflammatory mediators such as interleukin-6 and reactive oxygen species. Now there is a lot of talk about epigenetics and the microbiota as well, but that is still to be elucidated. So what about other cancer outcomes? We looked into, as I said, we looked into the mortality. We know that mortality is higher in obese patients. And what about recurrences? Does obesity affect the chance of developing recurrences in cancer patients? The answer is yes. Overall, we found out that obesity is associated with 13% increased chance of recurrence. So that's something to think about. This study here looked into the increase in BMI and the chance of developing recurrence. As you say, with every increase of BMI, the chance of developing recurrence actually increases. Same thing here. The bottom 3 lines are looking into loco-regional recurrence. Obesity does not affect that. But if you see the top 3, these are increasing BMIs. And we can clearly see that as time goes, there is diversion between the 3 lines, indicating that obesity actually increases the chance of recurrence. And this was a meta-analysis that looked into 25 studies that clearly shows that that clearly shows that metastasis is actually increased in obese patients. So, having said that, what can bariatric surgery do? Well, we know that bariatric surgery has been established as one of the most effective and durable, the emphasis here on durable, weight loss treatments. We know that weight loss after bariatric surgery is maintained for up to 25 years. This is the SOS study, which followed bariatric surgery patients for more than 25 years. We know that with the different types of surgeries, yes, there are some weight regains, occasional, but overall, the weight loss is maintained for up to 25 years. So what does surgery do? In that same SOS study, when they followed the bariatric surgery patients versus the obese patients that did not undergo surgery for up to 16 years, we do not follow our patients for 52 weeks like the medication. We follow them for years. So we can see from the diagram on the right side, the divergence between the incidence of cancer. So those with no surgery, the incidence of cancer is much higher than those who underwent surgery. So we know that bariatric surgery actually modified the risk. It reduced the risk of developing cancer. And then more cohort studies actually came in consolidating that fact. And then a systematic analysis was done into these cohort studies that unequivocally shows that bariatric surgery reduces the risk. But then everybody will say these are small, observational, whatever, blah, blah, blah. Then we had population-based studies. So we had a number of population-based studies, and then we had a meta-analysis of almost 750,000 patients. These are the included studies, different bariatric surgeries. But it clearly shows that bariatric surgery reduced the overall cancer incidence. Moreover, it also reduced the obesity-related cancer incidence, the 13 cancers that we talked about, if you remember. Another study came in focusing on, and this is from a couple of years ago. It was published in the Diabetes Care, since you guys love diabetes. So this looked into cancer developing in obese patients with diabetes. Again, patients were followed up for 28 years, and we can see the divergence. This is patients without surgery, obese patients without surgery versus with surgery. The incidence of the incidence of cancer definitely reduced in this population subset. And finally, this is the best study out there. It's just been published. It's done by my dear friend Ali Manaim from Cleveland Clinic. It's just published last year. This is the Splendid trial. They followed around 30,000 patients for up to 10 years. So what we can see here is that they looked into the incidence of cancer, and again, same story. Cancer is less. This is overall cancer versus the obesity-related cancer. And on this slide, they tried to look whether different surgeries affected the cancer risk in a different way. And the answer was no. All surgeries did the same versus no surgery. And finally, in that same study, they demonstrated that the drop in cancer risk relates to the amount of weight loss. So the more weight you lose, the less the risk of you developing cancer. So finally, the final slide is, how does obesity affect carcinogenesis? Well, it does that by affecting the sex steroids. It affects it by reducing the adipokines that we talked about and reducing the chronic inflammation in the cells. Definitely there is reduction in insulin and growth factors. This will all lead to reversing this, which is we will increase apoptosis, we will reduce tumor cell proliferation, angiogenesis, and motility. So in conclusion, we know that obesity increases individual and population risk of developing malignant disease. The mechanism of how obesity causes cancer is multifactorial. It's not just one thing. The combination of these elements result in cancer. We know that bariatric surgery reduces the incidence of cancer, and it reduces the mortality of cancer. With this, I would thank you, and the floor would be open for questions, I suppose.